So my name's Lauren. I'm an occupational therapist from St Joseph's in Auburn, which is in Western Sydney. So when I was asked to speak to you today about the Saebo products, I thought I would style my response with a question and answer format. These are questions that I have asked myself and answered along the way during the 5 years I have used the SaeboFlex Glove. And they are also the questions I would have loved to have known the answers to 5 years ago when I helped my first stroke survivor to buy his SaeboFlex and provide his therapy. So what Saebo products does St Joseph's Hospital use? So at St Joseph's Hospital we have a small SaeboFlex kit and a SaeboGlove kit. The SaeboFlex was purchased in 2015 through a generous club grant, and it's primarily used for fitting and trials with patients to see if they would be suitable for the SaeboFlex. It is also used for inpatient therapy. The SaeboGlove kit was purchased in 2017 and is used for both trial and measurement for outpatients as well as for inpatient therapy. I discuss this a little bit more later on, but I do not loan out our SaeboFlex or our SaeboGloves. As I use them, I don't loan them out for outpatients, as I use them primarily for assessment and measurement to determine if they are a suitable intervention for the patient. So how does the SaeboFlex and the SaeboGlove work? So it works on the principles of neuroplasticity. As we know, for neuroplasticity to occur, the brain needs thousands of repetitions to create new motor pathways. However, when the stroke survivor can't complete one repetition of finger extension, how are they possibly going to achieve the thousands? So the SaeboFlex helps the person achieve these mass repetitions of finger extension with the assistance of a spring-loaded mechanism, while the glove helps with finger extension through rubber bands at the finger joints. The SaeboFlex and glove teach the stroke survivor to learn how to control the strength of their finger flexors and also how to relax this muscle, as the spring can't contract to open the fingers if the patient is still flexing their hand. These components are crucial for a person to learn so they are able to use their hand again. As the stroke survivor's finger extensors become stronger, the assistance provided by the SaeboFlex or glove in helping the fingers to open can be graded so the patient learns to do more of this themselves. The SaeboFlex allows only gross grasp and release of the Saebo balls to increase the repetition of finger extension. However, the SaeboGlove allows for more individual finger movement, and as such, the participant can work more on their fine motor tasks, such as using their pincer grasp. Some people are even able to wear the SaeboGlove throughout the day to improve the use of their hand in daily activities. Ideally, as the patient improves with activating their finger extension, they can be moved off the Saebo products and work on their movement through task-specific practice. So ideally, this is the therapy progression you would aim to achieve with using either the SaeboFlex or SaeboGlove. Upon assessment and goal setting with the stroke survivor, it is identified they want to be able to open their hand to pick up items. However, as a result of their stroke, they are able to only close their hand, finger flexion, and not open, finger extension. The SaeboFlex allows them to achieve the high repetitions required to assist in the facilitation of neuroplasticity for finger extension. As the patient improves in this area, which you will identify as their release time of the ball quickens, their spring resistance can be downgraded. This means the participant has to do more of the finger extension themselves, and the SaeboFlex helps less. Your next grading option, as the patient continues to improve, is using the SaeboFlex for the first half of your session and then removing it for your second half. Using the SaeboFlex to start with, I find helps with activating the finger extensors while also providing a bit of a stretch to the finger flexors. So in the second part of your session, the participant is able to achieve grasp and release on their own. Eventually, as these muscles get stronger, the participant is at the stage where they have enough strength and activation in their hand to do the exercises and achieve their mass repetitions without needing the SaeboFlex. And at this stage, you can then provide your patient with task-specific exercises based on their goals. So is the Saebo different to other therapy interventions? My answer is yes and no. So the SaeboFlex and Glove are based on the principles of neuroplasticity, occurring through high repetitions for cortical reorganisation. So in that sense, yes, the SaeboFlex and Glove are similar to using your mirror box or electrical stimulation for therapy. However, my answer for this question is yes and no. So yes, the principles are similar, but I think there is also a significant difference I have seen for some patients who have used the Saebo products who have also used the mirror box or eStim. For all of these interventions to be effective, cognitive engagement is fundamental. How many times have you seen your stroke survivors completing their eStim exercises in front of their TV? Or have it on their wrist extensors while talking to their visitors? How many times have you seen your patients completing their mirror box therapy at record speeds? So I think it can be very difficult for moderate to severely impaired stroke survivors to remain cognitively engaged with eStim or mirror box for the extent of the repetitions required. And yes, you can use your coaching skills and set up their exercises in unique and engaging ways. However, if the participant is unable to initiate or show a flicker of a contraction in their finger extensors, then ensuring they continue to try to send those signals for high repetitions of finger extension with eStim or mirror box is difficult. With the SaeboFlex and SaeboGlove, I noticed that participants remain engaged in their therapy. For each release of the ball, they are trying to be engaged. I can feel much more confident in knowing how many repetitions my patients are completing in their therapy times. Another significant difference is with the SaeboFlex, you can design your exercises to incorporate proximal movements and increase shoulder control and strength, improve dynamic standing balance or muscle isolation. I will show you some examples later of exercises that I might set up for my stroke survivors, but when using mirror box or eStim, it can be difficult to incorporate such additional components. So how to choose between the SaeboFlex and the SaeboGlove. So both devices are for participants who want to work on the grasp and release of their hand. However, they have weak finger extensors impacting upon their pre-shaping for grasp and for their release. The patient might also have spasticity in their affected hand. So the SaeboFlex is best suited for patients who have muscle activation in their flexor muscle groups. They might have some spasticity in their finger flexors or their wrist flexors, and this could be moderate to severe and have some shoulder activation in any range. The SaeboGlove is best suited for those who might have only mild spasticity in their finger flexors. Because of the design of the rubber bands pulling back at the individual joints, it is better for fine motor tasks of grasp and release, whereas the SaeboFlex has a stronger resistance to combat moderate to severe spasticity and pulls the fingers back together. So don't let the cost or the ease of fitting the SaeboGlove affect your clinical judgment for your patient as to which device will best help them achieve their goals. If your stroke survivor has moderate to severe spasticity, the rubber bands in the glove won't be strong enough to pull the hand back into extension so they are ready for their next repetition. So what exercises do I prescribe for the SaeboFlex? So my exercises focus on grasp and release and the repetition of finger extension. I designed the exercise so the only difficult component is the release or the finger extension. As this becomes easier, I work in more components. So they have 10 Saebo balls, so I ask them to go through each exercise 10 times of either 2 to 3 sets, aiming for 250 to 300 repetitions per 1 hour session. So in this first video, the exercise is focusing only on the grasp and the release. So this gentleman is around 7 months post-stroke and only just learning how to activate his finger flexors. This movement is so difficult, I'm needing to provide some assistance with the positioning of his arm and hand so he can focus on just the flexion of his fingers for grasp. You can note he's also on the lightest spring resistance. Initially, when he first tried to complete this exercise, he couldn't flex his fingers for grasp without activating all his flexor muscles, which meant his hand would move further away from the ball the more he tried. For the first few weeks, this was all his exercise program consisted of. And at home, he would guide his hand with his left. This was an outpatient. In for the ball, good. Squeeze in. Squeeze, squeeze. Good. Now lift, lift. Good. And relax. Good. So this next video is taken several months later. And you can see the improvements he has made. Yeah, you can see the improvements he has made with his shoulder activation and control, the speed and the efficiency of his grasp. So this exercise has been designed to improve his proximal strength, as he has to flex his elbow to release the ball to the target, as well as the control of the release. So he has to control the release of the ball and the position of an arm so it lands in the cone. And this recovery has allowed him to use his arm as an active assist throughout the day. So as the release time becomes easier, that's when I start to grade the exercises to include proximal shoulder movement or teach the patient to isolate muscle contractions. An example of this is the setting up of this exercise as in the picture shown. So it teaches the patient to grasp and release the ball while activating their shoulder flexors, which is often a difficult component for our patients. So this is another exercise where the patient has to maintain their grasp while sidestepping to release the ball. Good, keep squeezing. After the 50-minute session with the SaeboFlex, it then gets removed, and the aim is to complete about 10 minutes, attempting grasp and release of a small ball without the device. The finger flexors tend to be a bit more relaxed once the SaeboFlex is removed, and hopefully the finger extensors are more activated after the session. And this is where you start to see some of the changes when they can demonstrate some active finger extension and release the small item. So what outcome measures do I use? So generally I will use the box and block test or the MMT, and I find them most useful for capturing either the improvement in muscle activation or the increase in active movement and speed with their grasp and release. I also tend to do some videos as well, and the videos are a good way to show the patient how far they have come with their overall arm movements. So do my patients own their own SaeboFlex? Yes. So for a lot of stroke survivors, their rehabilitation journey is a long one. The SaeboFlex is not a quick fix or a miracle device, and as such they need time using their SaeboFlex to allow for neuroplasticity. I once spoke to a therapist who had a stroke survivor using the SaeboFlex for a month or two. He had very minimal arm and hand movement and was coming close to a year after his stroke, and I asked how he was going with it. She replied, "Oh, he's stopped, it didn't work for him." And I thought, what a shame. Of course you won't see a significant change after 1 month using the Saebo in being able to open the hand, especially depending on the extent of the damage from the stroke. We know neuroplasticity can happen years after a stroke, and the participant requires time and repetitions to make those changes. At St Joseph's Hospital, we don't have a loan system. So the SaeboFlex is something they are interested in for their therapy. They need to purchase their own. Buying their own means they can complete the exercises daily and achieve the mass repetitions they need for neuroplasticity. A loan system might work at other hospitals. However, the Saebo kit we have is not big enough for stroke survivors to be able to loan a flex for months or in some cases years on end. All except one participant I have shown the SaeboGlove or Flex 2, which might be around 10 to 15, have bought the device. 2 have been funded through the NDIS, 2 through part charity assistance, and the others the patients have privately purchased. I work in Auburn in Western Sydney. This is not an affluent part of Sydney. But once the stroke survivors and families trial the Saebo and see how their arm can work and complete exercises, I believe it fills them with hope for their arm, which is something they haven't felt for a long time, and they purchase the device. So what's my experience of the SaeboFlex? For me, I love the SaeboFlex. I was frustrated with seeing the limitations on stroke survivors' recovery because their finger extensors would not improve using e-stim alone. And of course, this is also frustrating for the participants who are putting hard work into their exercises and not seeing the results. The SaeboFlex allows me to provide another intervention option for stroke survivors. Everyone who I've used the SaeboFlex with has made a change of some sort. Not everyone, unfortunately, will get movement back in their finger extensors for grasp, but everyone I have seen has made other improvements. These often include their arm getting stronger, so they can use it as an active assist during the day, or learning how to control the spasticity better in their finger flexors, so they have less discomfort, no longer require botulinum toxin injections, and sometimes even reduce their spasticity medication. So I wanted to finish off with a case study of a gentleman who I saw in outpatients 2 years after his stroke. He had good shoulder movement and strength, however he could not open his fingers and he really wanted to work on the grasp and release of his hand. He had been using e-stim for the past 2 years, trying to improve this component with no change. So this is what his hand looked like. So you can see he's trying to open his hand, but he has no movement in his fingers or thumb. In a minute you'll see he eventually gives up trying to open and he just uses his other hand to shove the ball into his hand. At this stage he has a box and block score of 0 and MMT for finger extensors of 0.
Just stuck now.
So he purchased the SaeboFlex and completed 300 to 400 repetitions twice daily for 4 months. And this is what he then looked like. So you can see the active movement in his fingers and thumb. Not enough though that he's able to pick up the ball, but at this stage I changed his exercise program to 20 minutes with the SaeboFlex on and 30 minutes without. After another month, this was his progress. And you can see he has improved his fingers extension and thumb movements even more. Though he had improved his gross grasp, his pincer grasp was still very difficult when he was seated. And you can see in this video he has a lot of problems opening his fingers and thumb when his arm isn't hanging beside his body and standing. At this stage, his spasticity was significantly less in his hand, and he purchased the SaeboGlove, which allowed him to complete mass repetitions of pincer grasp and release. Unfortunately, I did not take any videos during this time, but he made improvements which allowed him to meet the criteria for constraint-induced movement therapy. And at the beginning of CIMT, his box and block score was 7. So remember, and initially it was 0. So to give you an idea of the time frame, this gentleman participated in CIMT 9 months after his SaeboFlex purchase. At the end of the 2 weeks of CIMT, this was the changes in his hand. So you can see the significant improvements in his pincer grasp as he is actually able to move his thumb and fingers with his arm resting on the table. And one of his goals was to be able to use both his hands to pull up and down his trousers, which is what our next video is. So at the end of the 2 weeks, this goal was achieved. In the video, I want you to be watching his left hand because that's his affected side. So then telling him to put his hand back in, and you can see he does passively position it a little bit, but then as he's pulling them back down, keep watching that left hand, and you can see how much active movement he has of his thumb and finger as he uses his pincer grasp to quite easily and efficiently adjust and pull his clothing. So at the end of the CIMT, his box and blocks score was 14. And it was, remember, 7 before CIMT and 0 before the Saebo. And his finger extension with his MMT was about a 2. So now he is able to use his left arm throughout the day for reach and grasp. And remember that this man had no active finger movement 9 months ago, 2 years after his stroke. So through the repetitions facilitated by the SaeboFlex, this man was able to achieve his goals. Thank you.